Now, let us discuss the benign disorders of the thyroid. Let us see the first slide. The first element of the thyroid is Hashimoto thyroiditis. Also, the synonym is chronic lymphocytic thyroiditis. Here, it is an autoimmune disease. Here, antibodies are generated against the thyroglobulin, which is a glycoprotein synthesized by the follicular cells of the thyroid, and also against the thyroid peroxidase, which is again very important enzyme that is a catalyst for the synthesis of the thyroid hormones, namely T3 and T4. In this element, there is increase there is diffuse infiltration of the lymphocytes to the thyroid parenchyma with the fibrotic septa extending up to the parenchyma. So in this we can see there is diffuse infiltration of the lymphocyte. That is why we call it as chronic lymphocytic thyroiditis. Here we can find multiple or single regenerative nodules here in this condition. We may find it. How this is diagnosed is there is a raised level of the antibodies against thyroglobulin and thyroid peroxidase. These elevated levels of the antibodies we can detect in the laboratory. Another the laboratory finding is there is a low T4 and the T3. There is a patient will develop hypothyroidism, and as there is a hypothyroidism, so that hormone uh, liberated by the anterior pituitary body, we call it thyroid stimulating hormone, that can be raised up to stimulate thyroid for increased production of the T4, T3. So hypothyroidism, it is very much associated with this condition as the chronic lymphocytic thyroiditis or Hashimoto's thyroiditis. So for this genesis of the ailment, there is autoantibodies, that is thyroid peroxidase and thyroglobulin antibodies. With this, there is a thyroid inflammation with destruction of the thyroid tissue and the fibrosis. There is so diffuse infiltration of the lymphocyte in the thyroid parenchyma, and there is also excessive fibrosis. So with this, there is a raised thyroid stimulating hormone level, and with this, there is generation of the multiple micronodules or a large nodule that can change to lymphoma, that malignant condition, or papillary cancer, which is taken as the commonest cancer of the thyroid. But it prognosis, it is better if there is the say timely intervention. So this condition of the hypothyroidism associated with this Hashimoto's thyroiditis, it can be responding to the exogenous thyroid. That is, by giving thyroxine before we can treat this condition. Now let us see the next disease. That is Graves' disease. Again, this is very commonly encountered element of this thyroid. This is also taken as an autoimmune disease of the thyroid. Whenever there is autoimmune disease of thyroid, it is becoming painless. Pain is almost nil with this condition. So this condition, it is associated with the hypothyroidism, then enlargement of thyroid, that we call it goiter, and then there is ophthalmopathy. So here exophthalmosis, the enlarged say eyeball, and then very say ocular say edema, all those things can happen. Then sometimes that is uncommonly it is associated with dermopathy, that is skin elements. So diagnosis, there is with the clinical features, with the clinical examination, we can detect the presence of the hypothyroidism. So those happenings with hypothyroidism in the say coming slides we can discuss with. So in the respect of the laboratory testings, so here thyroid stimulating hormone is suppressed. Then there is a rampant increase of the thyroxine T4, maybe free or bound. So there is excessive increase of the thyroxine, then there is a suppression of the thyroid stimulating hormone liberated by the anterior pituitary body. So those symptoms and the signs associated with the hypothyroidism we can discuss with. About the symptoms, there is nervousness, irritability, hyperactivity, heat intolerance, and the sweating, weight loss in spite of the increased appetite, then diarrhea, palpitations, fatigue, and weakness due to the myopathy, then oligomenorrhea, that is decreased menstruation. All those things are the symptoms complained by the patient. And coming to the signs, that is findings when we are performing the examination of the patient. So there is tremors, then this can be demonstrated by keeping acid or paper over the extended fingers. Then by palpation, warm and moist skin we may detect, say by palpating the say palm. So then tachycardia may be there, then atrial fibrillations, high pulse pressure, proximal myopathy, diffuse alopecia, goiter, diffuse or nodular, lid retraction, exophthalmos, periorbital edema, thyroid dermopathy. All those things are associated with in Graves' disease. This finding, these lab findings, these are associated with the disease. So all these findings are the symptoms and signs of hypothyroidism. So Graves' disease, it is condition of say hypothyroidism. So these four findings, it is always almost associated with the Graves' disease. Okay, let us see the causes of the hypothyroidism and the thyrotoxicosis. Number one is the Graves' disease, that is autoimmune disease, then toxic multinodular goiter, autonomous nodule, then thyroid stimulating hormone secretory pituitary tumor, functioning thyroid cancer or metastasis, exogenous intake of the thyroid hormone, that is excessive intake of the thyroid hormone that can give rise so-called thyroid toxicosis, pectisia, then thyroiditis, inflammation of thyroid. All these things can give rise the condition of the hypothyroidism and the thyrotoxicosis. Okay, coming to the hypothyroidism, so how it is produced, let us discuss with the following slides. So it is due to the low level of the thyroid hormones. So how it is produced, let us discuss with. Causes, iodine deficiency is the main cause. Then Hashimoto's thyroiditis, as we have discussed, total or subtotal thyroidectomy, post-surgical intervention, then radiation to the neck, so for other ailments, neck malignancies, then radioactive iodine administration, then certain drugs like amiodarone is indicated when patient is having cardiac arrhythmias. Then lithium, para-aminosalicylic acid, antithyroid. Here, what we are using are that PTA, PTU, propyl thyroid uracil. Then another is carbimazole. So that PTU, propyl thyroid uracil, it is mainly used when that woman is having pregnancy. During pregnancy, this is the only the thyroid that we can prescribe with. Then coming to the last condition for causes of the hypothyroidism is the goitrogenic substances. Here, about the goitrogenic substances, we can say the cabbage, it is contained goitrogen. Another one is turnip, that hangamula. So these two substances also can induce hypothyroidism. Yes, coming to the coming about the these conditions associated signs and symptoms associated with this hypothyroidism, that is fatigue and the weakness, intolerance to the cold, dry skin, coarse and sparse hair, hoarseness, poor memory and the lack of concentration, weight gain, excessive menstrual bleeding, followed later by the oligomenorrhea. These are the symptoms. And coming to the signs, dry and the coarse skin, puffy face, puffiness of the hands and the feet, loss of the hair, bradycardia. All those things are associated with the hypothyroidism. So coming to the treatment, For treatment, exogenous thyroid hormone before we can prescribe it. Then hypothyroidism in units, it is again ready to be discussed with because if we are timely intervening, if we are not rendering time intervention, then it may lead to the permanent disorders with that neonates. So here hypothyroidism is occurring to the neonates, so that can produce cretinism. Here, what are the signs and symptoms of the cretinism are: number one is the lethargy. The child may not be responding to our arousal. Then number two is the stunted growth, the dwarfism, it is associated. Number three is the baby may be having hearing loss. So these are the associated. Then one more association is the delayed milestone. Delayed milestone. So it is mental retardation the baby may be having. So these are the things associated with the cretinism. Whenever we are thinking that that baby is having this hypothyroidism, we should intervene properly. And during the say intrauterine period also, the mother should be kept at the state of the euthyroid. If we are keeping in the state of euthyroid, then this condition, this resulting cretinism, it can be avoided. Then coming to the next condition is subaqueous lymphocytic subaqueous lymphocytic thyroiditis. Here, the okay. Uh, this subaqueous lymphocytic thyroiditis, it is also taken as the silent thyroiditis because it is painless. It is without pain. Although, in spite of say thyroid enlargement, there is no pain. Why it is painless? Because it is considered as autoimmune. Whenever it is taken as autoimmune, then patient is unlikely to have this uh, pain will be absent. That is the thing. Then it is occurring mainly to the female and occur at the postpartum period, and there is painless enlargement of the thyroid small goiter. Then first the lady will be having that hypothyroidism. So it is followed by the hypothyroidism. Then after say a few days or after a few months, the patient may regain euthyroid state. So this is again we may encounter in our day-to-day practice. Again, next condition of the benign disorder of the thyroid is the Coravans thyroiditis. Also, we call it subaqueous granulomatous thyroiditis. Here, it is painful. Whenever there is painful swelling of the thyroid gland, then we may consider this one. And it is again associated with a fever, pain at the neck. Pain also can be present over the jaw and ear. It is thought to be triggered by the viral infections, mumps, flu, etc. So, if these are happening, then we may consider about the suffering from the coronavirus thyroiditis, that is subaqueous granulomatous thyroiditis. Yes, if it is preceded by having all the mumps, enlargement of the parotid, enlargement of the submandibular salivary glands, then viral fever, say rhinorrhea, then fever, then body ache. All those things are associated. Then we may consider that condition of this decarbonized thyroiditis. Okay, thank you for today. Let us stop here.